Hello, my name is Suzanne Arnott, and I'm a surgical resident at the George Washington University. As she said, I'll be discussing the safety of robotic surgical management of non-elective colectomies for diverticulitis compared to laparoscopic surgery. I have no disclosures. So robotic surgery has been well described for diverticulitis within an elective setting for a long time in the literature. Minimally invasive surgery, however, while very well described for urgent and elective cases here at this conference, is still fairly controversial. The goal of our study is to look at the short-term outcomes of robotic colectomies for non-elective diverticulitis cases. This was a retrospective study of NISQLIP between 2012 and 2019. We identified our cases by CPT codes for colectomies and the ICD-9 and 10 codes for diverticulitis. We then eliminated all open cases and all of the elective cases within that larger cohort and grouped the remaining cases by approach. We then compared these groups, the demographics, operative variables, and postoperative outcomes between the two groups. And our kind of three primary endpoints that we looked at was mortality, sepsis, and reoperation. In total, we looked at 6,880 colectomies, only 297 of which were done robotically. There were significant differences between the groups, most notably the higher rate of preoperative sepsis, emergency case status, and wound class 4 within the laparoscopic group, though the rates of most medical comorbidities and ASA class was equal between the groups. When looking at the postoperative outcomes, the only statistically significant differences between the groups was that there was a higher rate of bleeding within the robotic cohort, and then there was a higher rate of postoperative sepsis and a longer length of stay within the laparoscopic group. We then entered all of the kind of preoperative variables that were associated with a p-value less than 0.1 into a multivariate regression model for our three kind of primary outcomes being mortality, sepsis, and reoperation, and found the following factors to be independent predictors for these outcomes. And as you'll notice, that the robotic approach was not significant for any of these. So when controlling for confounders, the robotic approach was not significantly associated with an increased risk of mortality, reoperation, or septic shock. This study was limited by the small sample size of the robotic urgent cases. Additionally, because it is a retrospective database study, we are limited in our determination of patient acuity to the variables that were provided. And kind of as previously mentioned, there was a difference between the two groups, which may have accounted for the postoperative outcomes. However, we did feel that this showed that robotic surgery is a feasible option for the non-elective management of diverticulitis that's at least equivalent to laparoscopic surgery. That is it. Thank you.